Primary Care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever so relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Good morning, Dr. Andrews. I'm so excited to chat with you today.
Yes, good morning.
It's been a minute. Lots of changes have happened in your life. Lots of changes have happened in all of our lives, but I'm really excited to, at this moment, when we're talking about the advancements and changes that we've had in our movement, in the DPC movement, just in the past year, when it comes to how we empower ourselves, this is what we're going to be talking about today. So from one Lego mom lover to another, I'm super excited.
Yeah, and little plug there.
Love it. Oh my goodness. So for those of you who are watching the YouTube version, Dr. Andrews has the Milky Way on her wall in Lego. Amazing. So for those of you who might not have met Dr. Andrews yet or might not have seen her Lego earrings, I have to put a story in here because the last time we sat down at breakfast before one summit, I can't remember which one, she had her green Lego earrings. And to me, Legos are such a fun thing to do. They keep me busy when I need something to do. They are so fun because of all of the little Easter eggs. But for me, that's the first thing that came to mind when I was thinking about our chat today, because when we think about the way that you built the Milky Way out of pieces, we have so many pieces that come together that lead us into the journey of DPC. And your journey is definitely filled with a lot of pieces. And I think that of anything, it's this model that allows us to be the doctors that we are meant to be, but also it allows us to be the human beings that we are meant to be. And do things like take time with people and talk about lifestyle medicine and do Lego sets.
I love that. That's so true. I find myself trying to recreate and tell my story to patients and other doctors who come visit my office over and over again. And I've kind of like simplified it lately to this. At first I did it for myself, then I did it for my patients, and then now I'm doing it for the movement and for other physicians. And that's been the trajectory of this journey for me.
That's fantastic. And just so for everybody who is not aware, Dr. Andrews is an internal medicine pediatric specialized physician. I also want to throw in here that you have a background in engineering before you even went into your journey in medicine. And so you're doing primary care with this background in engineering. And I'm just wondering, just going back to why you even chose DPC. We talked about what are the after effects of DPC, but I'm wondering from your perspective, what are the ways that you saw the pieces of your life coming together under the DPC umbrella, being able to serve your patients best versus concierge medicine or versus only doing consults, like lifestyle medicine consults?
The weaving in of my background in engineering definitely plays a big part of that. And actually, you asking that question has really put that in context for me. I like solving problems, right? I like big picture. I like the puzzles, and engineering is inherently a systems background, thinking about how everything interacts together. And I have considered through my journey, whether it was in residency, when I was finishing up the 4 years of like the dual board certification, should I go specialize so I can just focus on one thing? And I kept coming back to this, and that's I cannot separate one thing from the other. Everything is interconnected, and I can't help see those connections. And it's important for me to be able to take those deep dives and to go down that pathway and look at how all these things interact with each other. I often tell my patients, nothing in the body happens in isolation. If I were only to focus on one thing, I would miss out on the opportunity to see how all these things are interacting and actually solve the root cause of the problem. So that's what drives me and why I chose the career I did and why I stayed primary care and why I like to do all the things for my patients. And what DPC has allowed me to do more than I realized is to use my full brain. I kind of knew that I was feeling like the life was being sucked out of me, not just because of burnout, working for a healthcare system and a fee-for-service model, but also because I knew I had more to give. I knew I had more skills. I had more things I could be doing, and my brain was slowly dying. And within like 6 months of the transition, leaving, my husband was like, who are you? Like, you have come alive. This is the woman that I met before you started your job. Like, the full breadth of my creativity, my brain literally felt like it opened up and I could be my full self, whether that was in exploring how to improve, efficiencies in my practice, whether it was helping patients improve. I could just, there was no limits. And so basically doing this took the limits off of what I was capable of pushing into. And it's just been so amazing.
I'm leaning into Legos hard because as you're talking, I'm like thinking about when there's limitless Lego pieces on the floor of our house and like, oh, you want to make a dragon? We can make a dragon. You want to make a post office? We got you. Whatever it
Yes.
is. And so when your creativity though is allowed to and not physically be so painful as stepping on Legos, when it's allowed to then just pick up different pieces that you want to incorporate, or you're able to build something that is feeding into the system that you want to build. I think that's so powerful. And I love that you're thinking from a systems background, especially one primary care doctor to another. It's like you never know what your patients are going to be talking to you about, like at all.
Right.
And you
At
need to,
all.
yeah. And you need to be able to say, like, I actually do know something, or I don't know. But all of those are pieces of the conversation when we're with patients. So now tell us, because when you had opened your DPC, you were under a different branded name. And then now
Right.
you have a clinic with another physician. You have your MA who's going into nursing. You have your clinical and business strategist. I mean, you have a whole team behind you.
Mhm.
And I'm just wondering, tell us about this transition, because I think that we've had some people on the podcast who've talked about have name changes for whatever reason, but you're in a place where in West Michigan, there's not a lot of DPCs compared to somewhere like Denver.
Mhm.
And yet, look at what you have brought together and have created for your community of West Michigan.
So Dr. Bailyn Amat, who was on my DPC story, like, I don't know, years ago, she started DPC West Michigan. And she was one of my early mentors in the movement. So I started off I interviewed all the DPC docs in town. At the time, there were maybe 4 practices, 2 of which no longer exist. And she really just grabbed on, and she was so just encouraging and very informative. In her practice now, DPC West Michigan will be celebrating 10 years next year. So when I started my practice, it was Seeds of Health, Direct Primary Care, and there's a whole story behind that. And I had no intentions of ever changing my name. I had no intentions of doing all the things that I'm doing now, but that's what happens with, evolution. She was entering a phase where she was looking to retire. She, unbeknownst to me, was looking to sell her practice. All I knew is that she was helping mentor me. She gave me a space to rent in her beautiful office space. I got to pay for some of the time of her assistant. And I reached this point after less than a year where I said, I really feel like I want to stretch my wings. I want my own space. I want to have a little bit more control over what's happening around me. And she said, well, that's interesting because I want to sell my practice. And I was like, well, so it made sense. I bought her practice. And with that, I just didn't know what I was going to do with it, aside from all the assets that came with it. There wasn't a panel because she was already sunsetting her career and I already had acquired some of the patients that she was planning on passing on to me. But I didn't know what to do with that. And there was this moment at the end of last year where I said, I've got this name that I own, this domain, this whole entity, Direct Primary Care of West Michigan. I'm in West Michigan, and direct primary care is reaching a critical pivot turning point where more people are starting to pay attention. We're actually starting to see more practices pop up. We probably have 3 or 4 new additions just since the beginning of this year. I said, I need to change my name. And that kind of goes into that third layer of what I was thinking. First, I did it for me because I needed to save myself. And then I wanted to be better for my patients. Well, now I'm thinking about bigger picture. What can I do to attract more clinicians to this? And having that name, Direct Primary Care West Michigan, is more than just about the practice. It's about making it something bigger than me that other people can see.
I think that that's so beautiful, the way you've layered yourself, your patients, and the community. Because when we talk about seeds, your original name for your DPC, it's like you planted the seed and have grown into Direct Primary Care of West Michigan. And so I think that's so beautiful. And yes, Dr. Amat, her story is so lovely. It definitely was a few years ago. So definitely take a listen to
Mm-hmm.
that if you haven't. But, I think it's so cool again to see how this practice has transitioned. And I'm just wondering, when you were transitioning and when you were building your team in the desire to serve yourself, your patients, and your community, what are the tools that you found most helpful? Again, I think about those Lego pieces coming together because there's so many options, but what tools
Mhm.
did you find foundational for your growth at your DPC?
Thinking about tools, well, first of all, you can't be a small practice or entrepreneur owner without having good tools. And at the time that I was making that transition, it wasn't just about rebranding, it was about aligning all of my tools to support that transition. And I was considering an EMR change, I was considering a phone system change. I was looking at all these things. And in our DPC community, we're always talking about all these resources. So it can be a very daunting task. So, in my typical engineering way, kind of like pros and cons, my little spreadsheet. And I had been considering for several months transitioning over to Hint. And I would say Hint has been the backbone. I ultimately made the transition in January, has been the backbone of all of the tools that I've kind of like wrapped around it. I really wanted to have something that would give me good clarity, like visible clarity of all the metrics for my practice, whether it's not enrollment, whether it's seeing which patients are past due, which ones, just I'm a very visual person. And one of the things I was really drawn to with Hint was the ability for me to see and to have this capture of information effortlessly. Just as soon as I turn my platform on, there it is. I can see it. Something that was really silly, but one of the things that I really wanted to do is I wanted to read my Google Calendar and block things off on my calendar without me having to manually do it. Every extra manual task you have to do, that takes away from something else, and it's also mental energy, right? So that was one of the handful of things that was a selling point for me. It would check my Google Calendar, block things off, and I could color code my calendar. I loved that. So I can see at a glance, okay, these are acute visits, these are physicals, these are new patients. So those are the kind of things that really get my brain buzzing because that's how my brain operates. That's how my brain works. I'm very visual and I really wanted something with those visual cues. And that was one of my biggest pain points. I mean, it seems simple, but that was something that really drove me to change. And then I also have been using Spruce for our phone management system. And one of the things that I really loved about that is, again, more of that big visual. It's very succinct, it's very good at handling messages. I can time things, I can group messages. I wanted to have something that would grow with our practice. And so I can assign numbers to, there's just all these little built-in things. And so like one of my things in engineering was software. So like I'm very particular about what kind of things I want things to do because I did user interfaces. I did software stuff. So I feel like I approach it at like, I should be able to do this. I know it can do this. Why isn't it doing this? So anyway, those are the two of the big tools that I've used. And then since then, there's been more things that I got from the Hint Summit since Hint has launched the marketplace that has been a game changer.
What I'm hearing is you're fighting fragmentation of your practice with the way
Yes.
that you are intentionally choosing your tools to grow. And I think that it really, like, all of us understand that because as physicians, we go to school in first and second year, we're talking about renal and then onc and hematology, whatever it is that we're talking about in systems. But then when we're putting it together, when a live patient is in front of us, um, it can be very frustrating when we need tools to adapt to what we're doing and the conversations that we're needing to have or the things we're needing to give our patients, and to have things at our fingertips definitely makes our job way easier. And that's why you see in direct primary care that we're not using the big corporate systems that are typically used in the big corporations. So I think that that's
Mm-mm.
a very sound way and also a very strategic way to grow your practice, is to think about how your tools are going to serve you and not how you're going to adjust your workflow so that you can work with the
Right.
tools that exist.
And that's exactly how I felt. I felt a little bit constrained again. I was feeling that rub of like, I'm feeling limited by my current tools. I needed something that would be nimble and would evolve with my needs and recognizing that a lot of us have the same needs. And that was something that I very clearly got from Hint. I mean, I was definitely on the sidelines watching and kind of like waiting for the moment, like, okay, that looks interesting. That looks interesting. I did that for at least 6 months before I finally made the leap, just looking if to see if my thoughts about it and how I thought it would help me were actual or legitimate. And then just in the short time that I've had it, there have been some really major improvements that have dramatically improved my workflow and efficiency. And that's what I was looking for. Not just having tools for the sake of having tools, but things that actually were meaningful, that weren't going to both add cost and headache and were going to improve my efficiency.
And deep diving there a little bit more, when you think about, I'm at a point now where could something be more efficient? Do I need to replace my tool with a different tool? Can I add something that is a little bit of an add-on, but it makes the tool that I am using even more robust and flexible? Something that was announced at this year's Hint Summit was the Hint Marketplace. And I'm wondering if you
Hmm.
can talk to us about, again, with your engineering and selectivity when it comes to tools, how do you, when you reach a point where you're like, okay, I am potentially able to be a better doctor with more efficiency, how do you approach things like the marketplace to allow you to achieve your goal?
Pretty regularly, at least quarterly, I would say. I'd like to make an assessment of what are our problem areas or what are the opportunities for improvement. And is there something within our workflow? Is there something within the tools we're using that we could improve? And if there is there already a solution that I'm not aware of? And with the launch of Marketplace, that's actually made that a lot easier because, oh, yeah, hey, look, here's a whole list of tools that have been curated that specifically work for practices like yours, and they are connected to our EMR. And so that's been really wonderful. So since that launch, for example, I initially had added spin. So spin was one of the things that I was really excited about because with my practice manager, so she started off as a phlebotomist, MA, now she's practice manager, and she does all of our purchasing. And it was very inefficient up until just recently. I was like, okay, here's the card, or she would say, here's the things I need to buy, here's the list. And then I would go through and do it. And I said, we can't keep doing this. I trust you. I need you to buy this stuff. Just do it. And so not only does she have her own card with the budget and it can be allocated for the supplies that we need, we also have the ability to purchase those supplies directly from within Hint. And then it's going to go roll right into our inventory. We can keep track of it there. That has saved us both so much time, so much time. And it was a solution that we've been looking for at least last year. And there it was.
I think that that is such a pro tip in terms of sustainability and growth. When you're reevaluating your workflows, your systems, your tools, because as you grow, you might need to pivot with your tech stack, with your intake forms, whatever. The beauty of our autonomous practice is that we can learn from what we're doing and improve upon them.
So, Hint Marketplace, for those of you who may not be familiar with it, it's kind of like an app store for your EMR. And some examples, I'll give you some concrete examples. So, there's apps, there's integrations, and there's partner solutions. You don't have to be a Hint user to use the partner solutions, but the integrations and apps aren't going to work unless you're on Hint platform. So, some of the things from the apps that I have integrated, there's FullScript. I use FullScript if I am going to be prescribing or recommending or reviewing supplements that my patients are taking, supplies, spend management. Those are three big ones. Oh, and then recently I added Vivleo Health, which will pull in EMR records for patients and then add it directly to my EMR, which is another time saver. So basically, what I've done is I have assessed what are the things that are taking time away from me, and is there a way to integrate it directly into our workflow? So, for example, with FullScript, I don't have to I don't have to log into FullScript in a separate window and pull that stuff. Like, it's already integrated into the patient's chart directly. So I can connect to that and I can see it within the patient's EMR instead of having to log out or go into a separate system. And then integrations, there are a few integrations that are logical. So Spruce integrates directly within Hint. And then there's also QuickBooks. So when I have all of my charging, I use QuickBooks for my accounting, it's all flowing directly into QuickBooks. So that's one less thing that I have to itemize or that I have to categorize within Hint or within QuickBooks. So those are just some examples of what Marketplace is used for and how it's been beneficial.
Going back to our Battle of the EHR survey that we did last year in New Orleans, it was very apparent that the user experience from the doctor's perspective, like the tools that are out there, we need them to help our days be easier. And so I really
Yes.
love the description of how you've integrated a thing to help with inventory. Amen to that. Inventory is a
Yes.
horrible situation when you have to do it
Horrible.
manually. I think that's really, again, highlighting bringing everything together to best represent your practice through
Mm-hmm.
efficiency in workflows and tech stack. That's fantastic. I think about, especially with you being a specialist in both internal medicine and pediatrics,
Mm-hmm.
I just think about the challenges between adult life and peds life also adds some spin to how you need your tools to work differently. Like I think
Mhm.
about in the adult world, they have their own access to their records, whatnot. But if you're taking care of a parent who also has four children in the practice, how do you manage those things? Some physicians who see kids get very frustrated with growth charts and still print
Mhm.
out the actual printed ones because the ones in the electronic health records don't work well in some EHRs.
Mhm.
But I'm wondering, like, how do you think about serving your adults versus your kids slash families when it comes to your tech stack?
That's generally in my short time as a DPC owner has been more of a limitation is the like everything is very adult focused. And so, like a lot of DPC doctors, I was printing growth charts and marking on there. Within my EMR, within Hints, we do have like growth charts for height and weight. Hint Clinical has growth charts built into it, and but it didn't have BMI percentiles, and they just added it. I'm so excited. So that was like one of those little pain points that makes a well child visit so much easier. So that was a win. As far as some of the big things for pediatrics that's different is all of the milestone things that we need to collect at each well child visit. So we have like MChats and then we have our ASQs and various questionnaires. And so one of the things that's been really nice, another feature is forms within Hint. And so being able to have a workflow where we can send forms ahead of time for moms or dads or caretakers to fill out and have it directly tied to the patient's chart, have it coming from the EMR. So I've been over time curating our forms for our pediatric population within our EMR. And that's been really helpful to not have, because I try to keep things as electronic as possible, because if it's on paper, it's going to get misplaced. I'm not going to look at it. It might not get scanned in. So it's just got to be there. And so that's been something very helpful because we do a lot of that the first year of life.
I know you're talking about the kids, but I'm thinking about first year of life in DPC. I wrote my notes on Quest labels yesterday, and our nurse was like, "Oh my God, I cannot even handle you." So, amen to no paper life. Amen to that
Yes,
so much. Oh my God,
yes.
I love that. Now, here's a question because you mentioned in the beginning you transitioned from another electronic health record, and I'm wondering
Mhm,
because that's really scary. How did you approach that? I know that you were watching things as things progressed at Hint, but I'm
mhm.
wondering, can you talk to that experience of the doctor who's like, "Oh my gosh, do I need to change? And how is
Yeah.
this going to work for me, my staff, and my patients?"
So it had to be like the juice had to be worth the squeeze, right? It was one of those scenarios. And we were just, my assistant and I, my right hand woman, we were just kind of like, all right, that's something that would make our life better. That's something that would make our life better. And we asked this question together and I talked to her about it on a regular basis. Well, do you think that would be a big time saver? Would this improve our efficiency? Or what do you think about it? So as things were coming up, I would juxtapose. And basically, once it got to the point where the cumulative benefit was greater than the perceived pain, and there were some very specific things that we were looking at, that's when we made the leap. But it still was not without fear. I mean, most of us who worked in the system have probably been through EMR transitions within the system and seen, and that was painful, right? So I still dreaded it. But I got a lot of nice little hand holding. We had like a little support staff that kind of helped with the transition. They're like, oh, we'll get all your records. And so having that support and then hand holding along the way kind of eased some of the tension. But there's still always going to be the rub of, okay, I've got to get all my patients in at some point as they're with the new transition. We're going to have to update a lot of the records. I mean, that's just going to happen. So again, I had to make sure that it was worth the transition, that the benefits were going to outweigh all that pain. And then I just gave myself some grace and recognized that every chart's not going to be up to my standards probably for the first 6 months to a year. I'll have to just address that as people roll in.
I'm wondering here when you are talking to other people who are thinking of transitioning to using an EMR like Hint provides, what are things that you remember from your transition that are helpful for other people to think about to get their charts ready to transition over? Because I think
Mm-mm,
about if you have a blackout, like we have frequently in Arnold, California, and
mm.
you don't have your records accessible, what are the things that you need to make sure that you have these available at all time, even if there's like a paper backup or something, as much as we hate paper, so that people's addresses or their medications, like, are there any tips that you would give to a person making the transition to an EMR like Hint?
So anytime you're going to make an EMR transition, again, just having not too long ago done this, making sure that the elements of your charts that you are going to be relying on are clearly up to date. I mean, you mentioned notes. I had to go through and make sure that all my notes were done because I still had some incomplete notes. Now, I was relying on the fact that at the time I was using a different AI note dictation platform than I'm using now. And so I had to go in there, okay, check off. Did I put this one in? Did I put this one in? Did I put this one in? And reviewing that. So one, make sure your charts are all up to date and confirming payment information because the EMR I was with before had membership management and this one did too. So I needed to make sure all that information was correct. Also communicating it to my patients that we're going to be making this transition. So you're laying the groundwork for that 3 to 6 months in advance. I mean, so this isn't something you're going to decide today and do tomorrow. So we did our part with data management, making sure that the patient's charts were up to date. And that, for instance, if I needed to make sure like their preventive screenings were documented in there correctly, their medications were documented. So like I had to make an intentional effort over several weeks to do that for our patients. And mind you, our practice is not huge and it wasn't at that time. So that was maybe a little bit easier. And actually I divided and conquered with my assistant. Here are the things that I want to make sure we have on each chart. Can you help me go through? You do these, I'll do those. So that was one big piece of it. And then when we did make the transition, I created a form to collect information that might be still missing because everything didn't transfer perfectly. So again, patients were already aware of it, that we were having this transition. Okay, we've made the transition. Can you complete this intake form to make sure that we don't have any gaps? And is there anything that we didn't make sure that we're capturing? So we kind of did that as a wraparound. I'll be honest with you, I haven't thought about having access to my data during a downtime situation. Do you have print copies of like
So I learned early on that when I was doing telemedicine home visits, that it was very painful when I didn't have specific demographics. And there's times when my apps won't get out information I need my apps to get out. And so if I do have cell phone reception, I needed certain things. So those types of things we do have manually on paper. But it gets tricky when your practice grows and you have to remember to update those things. So there definitely are frustrations with having backups that are physical. But, I will say that I think this is so helpful, especially at a time where we are having summits and people can meet in person. And this is the importance of meeting in person and talking about your practices because you asking me about how we practice in rural America is going to be different than how somebody practices in Sacramento. And I think that this is
exactly.
how we can evaluate our tools, evaluate our efficiencies, and see our own gaps.
I credit a lot of my evolution in thinking to being challenged by seeing things from different perspectives. I really don't miss an opportunity to interact with other DPC practices as much as possible. So the DPC Summit, for one, that's coming up. Love going to DPC Summit. And then I am co-hosting a DPC Mastermind in Michigan, the first time we've had one in Michigan. And it's really exciting because when I started on this journey, not only did I first meet the DPC doctors that were in West Michigan. Then I expanded to talk to DPC doctors that were outside of West Michigan, so on the east side of the state. And then the next phase for me was going to a DPC mastermind. And that was the first time that I interacted with so many of the docs who are now I consider close friends who are across the country and hearing how they solve problems, hearing how they manage their practice, hearing all of these things it's opened my eyes. And this could be true for anything, no matter what you do in life. You have to get outside of your own head. You have to get outside of your own region. And that has been extremely powerful for my growth. And I think my growth would be stagnant had it not been for being challenged by the ideas that I get from other people. So I encourage everyone, if you haven't attended a DPC event, I don't care what it is, go and interact with other DPC doctors, pick their brains, talk with them. It's wonderful. You will just be amazed at all the things that you'll learn and evolve. And two other things that I'm participating in that have also been really wonderful. And there's been a lot of overlap. So one of them is Hint Growth Track. I am participating in that right now. And then I'm also going to be a cohort mentor for the Hint launch boot camp. So I'm really excited about that. That's coming up. I think it starts next week. For those of you who may not be familiar with it, I think of it as DPC Mastermind on steroids. And it's a 10-week cohort. You're going to be with other people who are in the same phase of starting or launching their DPC practice. And you're going to have coursework on a weekly basis. There'll be a different speaker every week. And it's a really great way to kind of have a little bit of hand holding, if you will. I mean, we don't learn this in medical school and residency. And it's kind of like a little miniature, like internship, a little rotation, and you're learning from your colleagues as you go. So there's lots of resources out there. And some people are afraid to take that leap, to join those groups. And for one of the things that we haven't talked about is I love teaching, which is why I'm really excited about this next phase of where I am in my ambitions as a DPC owner about helping to broaden the movement and to teach others. Is I'm faculty at our local medical school in Michigan State. I've taught my whole career. I don't miss an opportunity to share knowledge because you grow in that process too, and you can help other people grow.
I think it's so beautiful going back to your different layers of taking care of yourself, your patients, your community. This is broadening that definition of community because you're giving back and helping strengthen the community of our colleagues, our fellow DPC physicians.
Exactly. And I'm just really honored to be able to be a part of the launch boot camp. And even more so, I'm really excited that I chose to switch to Hint Clinical. It was a very scary transition, but it has actually enabled so much more growth. I feel like it's helped catapult that because Hint, it's a whole ecosystem. You get a community within that. I mean, there's just ways that I have been able to connect with other Hint users through the platform and through the summits and through the connections. It has just enabled the kind of growth that I was looking for. I was looking for an ecosystem, for a space, for a community that would help facilitate that growth. And it is. And so it's so much more than just an EMR. Whether you're in the early stages and you're looking for that launch, or if you're trying to grow and looking for opportunities to be connected with a system and other people in that same position, it's a great transition. I would encourage you to look at it.
Well, I'm so grateful for hearing how you've grown and how strategically you have, again, going back to those Lego pieces, how you've put your pieces that you needed to maintain for your life, your patients, and your community together. And if you are out there listening, make sure that you take Dr. Andrews' words to heart. She is continuing to grow. She's continuing to mentor. I'm so excited that we get the chance to see her in New Orleans this summer. And if you have not, if you are thinking about, oh, I love tools that I use and they've helped me, make sure that you vote in our Battle of the Support Stack because tools like Hint and Hint Clinical are definitely tools that are helping people out there. So if you would like to learn more about Hint and Hint Clinical, go to hint.com/clinical, and you can learn all about the tools that Dr. Andrews is using right now as she grows her DPC. Thanks for being here for this episode of My DPC Story. Whether you stumbled across DPC for the first time today or you've been in practice for years, these stories are here for you, wherever you are in your DPC journey. And that's exactly how the Start Here page at mydpcstory.com is built now. It meets you where you are. New to DPC and learning the fundamentals? There's a path for that. Already practicing or in the planning stages and looking for practical tools? There's a path for that too. Ready to go deeper? That's covered. Head to the Start Here page at mydpcstory.com and find your starting point. If you have a question or challenge you want to hear addressed on the show, go to the contact page at mydpcstory.com and leave me a voice message. And if this episode moved you, please leave a 5-star review on Apple Podcasts. It's one of the best ways to help other physicians find these stories when they need them the most. For commercial-free episodes and extended conversations, check out our Patreon. There's a free tier and a paid tier, and both help keep the show going. Follow us on socials at My DPC Story and find everything from episodes, free resources, the DPC Toolkit magazine, and more at mydpcstory.com. My DPC Story is created and hosted by me, Marielle Conception. A huge thank you to the team that makes this show possible. Chief Growth Officer, Kira Hanselman, Head of Marketing and Strategy, Natalia Highland, and Chief Operational Officer, Alexandra Goebel. We are all in your corner. Until next time, this is Marielle Conception.